You're listening to the Inspire Excellence podcast, recorded at the BVA headquarters with your hosts, Kevin Miller and Tommy Ahlquist. Each episode is focused on shedding new light on different perspectives to create dialogue that inspires excellence.
Welcome once again to the Inspire Excellence podcast. Tommy Ahlquist with Kevin Miller. And Tommy, we've got one of the most, well, I'll just let you introduce our great guest who gets the headlines and gets people talking.
He does get the headlines. Wayne Hoffman's here. Welcome, Wayne.
Thank you. I'm still waiting for the sentence to be finished.
So Wayne is the president and CEO of the Idaho Freedom Foundation. Been in the news a lot lately. A couple of lawsuits going on.
Yeah, very busy.
We have to have you back to talk about urban renewal here.
Yeah, and I'd enjoy doing that.
But today we're here to talk about Medicaid expansion. We really appreciate Wayne being here.
Thank you.
Couple things I would just say before we get rolling. One of the things that I enjoyed about the Freedom Foundation during my run for governor is they are very data driven. And while there are not a lot of organizations in the state that have a lot of data, the Freedom Foundation has an arm that does have a lot of data, and they pride themselves on being a policy institute. And so also get a lot of flack, I think, out there. You have scorecards and, very conservative kind of, constitutionally based freedom organization. And I think we'll have a chance to talk about that. But today we've invited you in to talk about Medicaid expansion. As you know, it was passed on a voter initiative in the fall. It's now in our legislative process to figure out how they implement that. And we want to hear your thoughts on that. To let everyone know, we invited Lauren Necochea, who will be coming in here in about 20 minutes to talk about why Medicaid expansion is a good thing. And elected to kind of have her go second. She wanted to do that, but we want to have you talk about the law that's coming. Kevin, any thoughts?
I'm good. Wayne, let's talk a little bit about the expansion and your thoughts. And if it's bad, why did we vote it in since we're such a conservative state?
Well, first of all, I don't think it's going to be implemented because there's still a lawsuit that has to be ironed out. The arguments on that will be on January 29th. And I do think it's going to be found unconstitutional. Having said that, I do understand that voters voted to implement Medicaid expansion, but I also think that a lot of money was spent trying to convince voters that it was going to do something that it actually wasn't going to do. I mean, the idea, I think the message that people got in spades was, we have this Idaho money that's sitting in Washington, D.C., and if you vote for Medicaid expansion, then it's going to bring this Medicaid, this magical money that has Idaho's name on it back to the state. It would return it. And I think also the governor at the time made the argument that we were going to implement this Idaho program called Medicaid expansion, which actually is not true. So I think people have been misled. And I think the other thing that hasn't been really talked about is the cost. The thing passed, and then after it passed, suddenly everybody was concerned about how much the thing was going to cost. And that has not been worked out. I think when people start seeing how much money is going to come out of the public schools budget and the higher education budget and the budget.
So I want to make sure that everyone understands what's going on here, because it shocks me, frankly, blows me away that when I talk to people that I know about Medicaid expansion, what it actually was, what it means to the state, and what it means to them individually, how few people actually understood it. So I think you would agree that the way we fund healthcare in Idaho, the United States, is messed up.
Yeah, definitely.
I think sometimes people confuse the fact that we have great healthcare. Mm-hmm. We do. We're the envy of the rest of the world on the healthcare we have, but the way we pay for that healthcare is crazy. And a lot of that has to do with really bad policy at a federal level for years and years and years. And then private companies taking advantage of that federal policy, and we're in the mess we're in, right? One of the things I want to ask you going into this is, I think as I travel the state, healthcare is on the mind of everyone. People want solutions. So what would you say to those people around the state of Idaho that want a solution, and they'll say, well, at least there's Medicaid expansion. There's this hope that this is going to change things, because they don't hear a lot of other solutions from the conservative side of, all I know is I can't afford it. It's a huge part of my family budget. I can't afford healthcare anymore. So what are you going to do to help me?
The system we have today was designed by special interest groups, truly. Special interest groups working in conjunction with politicians. And as a result of that, you have healthcare shortages. You have a limitation on the number of professionals that can participate in the marketplace. You have insurance that is non-competitive, and you can't find a plan that fits your goals and your family's goals. This is a problem that was created by politicians. And so every time somebody gets excited about the cost of healthcare, politicians get excited and say, gosh, we got to do something. And they pile on more programs, more costs, less return on investment, and then rinse and repeat that same cycle again. So what we've said is there is a better way. There's no question about it. And we think that the better way is getting the government out of the healthcare marketplace. So for example, and some of those things are starting to take place, by the way, thanks to the Trump administration, with things like short-term health insurance plans. At least now you can avoid the Obamacare essential minimum benefits. So if you have a family that you don't need maternity care for whatever reason, you don't have to buy maternity care because that's something that doesn't interest you. And you can do that. If you don't need mental health services, you can say, I don't want that either. You get all that through the short-term health insurance plans. So that's a workaround around Obamacare, but that it still doesn't solve the bigger problems about the healthcare marketplace, which again is a creation of government at the behest of special interests. So things like hospitals getting these tremendous tax breaks and yet not having to show any kind of investment in the communities whatsoever. So when you call St. Al's or St. Luke's and you say, how much does it cost to have a hip replacement? They might tell you $1 million, or they might tell you, we can't tell you. Or they might tell you it's $11,000 on Tuesday, but it's $750,000 on Wednesday. I mean, that's kind of goofy, especially for organizations that are benefiting from property and sales tax breaks. So the question you have to ask as a taxpayer is, do these policies make sense? What is your ROI? What are you getting back out of this? Because it looks like you're not getting anything.
So I'm not going to let you off the hook. So if the policies don't make sense, and we agree with a lot of things, we've talked a lot about healthcare, you and I, and the answer is not Medicaid expansion, what are the answers here in Idaho? Because I think one of the things you'll hear out there is people say, great, you think that Medicaid expansion worsens the current problem, but what are you going to do to help me? What would be your answer to that?
Well, I'm gonna dial back a little bit and talk philosophical for just a minute. And I apologize, but the libertarian in me says I've just got to let them out and talk about just concepts of government, right? What do we agree that government should and shouldn't be doing? So, for example, the three of us are sitting here in this room, so we're not at our house. If I could be at my house right now, I might be sitting outside on the stoop with a shotgun, defending it from aggressors, burglars or robbers or rabid squirrels or whatever it may be. But since we all can't be at my house or you can't be at your house, we agree to have a police department. So we all pay taxes. The police department comes, surveils, looks for bad guys, locks up bad people, and so on. Same thing with a fire department, right? If I can't be at home right now guarding my house with a fire extinguisher, so therefore we all agree, hey, why don't we have a fire department? Put out fires in case something catches ablaze. Okay, we all agree to do that. And then even on roads, we all get to use the roads. But government starts failing when it starts picking winners and losers and just deciding certain people get help and other people don't get help, because invariably they're going to get that wrong. So, for example, in the case of Medicaid expansion, what we're basically doing is saying, I'm going to point a gun at you, Tommy, and I'm going to say, Tommy, give me $100. Now, am I committing a crime when I do that?
If you pointed a gun at me?
If I point a gun at you and say, Tommy, give me $100, is that a crime?
Yeah.
Right. What if I say, Tommy, I'm pointing a gun at you. Tommy, give me $100 and I'm going to give it to Kay Millie so he can buy health care. Is that still a crime?
Well, your point is that that's what's happening, right?
What's happened is we've legalized the theft. We've said we want Tommy and Wayne to pay for Kay Millie's health care, so we're going to pass a law that says we're going to take money from you and we're going to give it to him. By the way, this is the very definition of socialism, from each according to their abilities to each according to their needs. That's what that is. So then, all right, so from a philosophical point, we agree that that's wrong, that's bad. What should we do about it instead? And what I've argued is the thing that we need most as a society is for everyone to be involved in everyone else's well-being on a voluntary basis. So in other words, I see K. Miller, he needs help, he needs health care, and he comes to me and says, hey man, I've got to have a hip replacement or whatever, can't afford it. Can you help me out? And I say, yeah, absolutely, I'm going to help you out. Here's $100. Now I'm invested in his outcomes. Now I care about whether he gets better or not. If we do it the way we've been doing it, number one, the people who pay the bills are not invested in people's outcomes. They don't even know. They have no idea who's benefiting, if anyone's benefiting. That's problem number one. The second problem is no one cares about the costs. So it costs whatever, and we're going to take care of it. No one's ever going to second guess that. In Idaho, as you well know, Medicaid pays 100% of whatever the hospitals charge. So that's really messed up. So we'll pay whatever as taxpayers, and we'll give the hospitals whatever they ask to be billed. And that causes an escalation in healthcare costs, part of the escalation in healthcare costs. My point is that government has only made the problems worse on two fronts. One, it's increased costs, and two, it's separated community, people who care, from people who actually need help.
Get it? Everything you just said, I understand philosophically where you're coming from, but understanding that we've got now, decades of government involvement and policy that has driven us to where we are today. I still haven't heard you say, you're king for a day. You can make 3 changes to current Idaho or federal law to improve things for us. What are those changes? What are the alternatives to Medicaid expansion that would make things better today? Because I do think people are hungry. They're desperate to hear solutions that reverse this problem that's gone on. And I think that's part of the problem that we're talking openly about today is what are the alternatives and who's leading that charge?
Yeah, unfortunately, there are too few people. But here's the problem. A lot of people expect from me as a conservative / libertarian to say, my solution to the problem is this program that I've designed, and here it is, and here's some pie charts and some flow charts and boxes and organizational patterns and all that kind of stuff. That's not what I'm going to do. I'm telling you that the problem is government. So instead of creating something, I deconstruct something, which is the fragmented way in which healthcare has been built in America. It started with wage and price controls in the 1940s under FDR, where basically he said you can't pay people more than what they're making right now. Remember that? And then as a result of that, employers started doing what? They started offering health insurance to employees to get around wage and price controls. And then the outcropping of that today is that everyone expects that when you go get employed somewhere, part of that employment is going to be health insurance, which has also created another problem with regard to price. And that is that most people, if you walk into a room and say, okay, I want you to raise your hand and say how much money you're paying for health insurance, most people couldn't tell you. And when they walk into the doctor's office and they get, an exam because they've got a head cold or, a cough or whatever it may be, they have no idea what they're paying for even that. They don't know what they're paying for blood work up there. They don't know what they're paying for anything. So that has caused a disconnect between the payer and the payee, which causes prices to go up also. So my solution is to deconstruct the current system that we've created. And there are several different ways you do that if you could wave a state and federal magic wand, because it takes a little bit of both. Number one, and I won't separate them, I'll just throw them out there. Number one, I would completely get rid of health insurance regulation. Health insurance regulations that say, here's what your policy is to contain, here's what it shouldn't contain, here are the provisions, here are the things you have to buy. There are also elements of health insurance, of course, that segregate populations and cause some populations to pay more for health insurance than they really should because they're subsidizing other populations. I'd get rid of those entirely. I'd allow for people to be able to buy health insurance anywhere they wanted to, whether it's another U.S. state, a territory, even another country, because that is your decision. I'd get rid of a lot of the occupational licensure restrictions that prevent people from being able to see the kinds of patients they want and receive the kinds of treatments they need. I'd get pharma out of the equation, where pharma pharma has a special leg up in terms of the types of treatments that are being offered. There's a sort of perception that if you need help, it's going to be something pharmacological, which is kind of goofy. And I would completely get rid of the special favorability treatment for insurance in the tax code. When you give somebody a benefit in the tax code and say it's because you're buying health insurance through your employer, then it de-incentivizes other kinds of solutions. For example, health share ministries or using direct primary care. That's a lot of stuff in a short amount of time. I can elaborate, but there you go.
No, that's great. That's great. I think people need to hear those, those alternatives. I didn't hear you talk a lot about cost of healthcare. I think transparency would be something that I would love to see in the system, because I do think if I go back as a doctor 5, 6, 7 years ago, I think there was a mentality out there that was a little bit, hey, I've got my deductible. Once I hit my deductible, it doesn't really matter what things cost after that. I think that is gone now. In my travels, people want to know what it costs. I've hit my deductible, but that hip replacement should not be $52,000. I've hit my deductible, but that shoulder shouldn't have been $38,000. I think people are hyper aware of costs right now. And I think that's what's going to give us an opportunity as a nation and as a state to say, okay, it costs too much. What are alternatives to cost? And I think transparency, whoever figures out transparency, I would add to your points there. I think that's a big deal for patients and employers and providers.
Yeah, you're right. And I think, for example, the Oklahoma Surgery Center that we keep hearing about in Oklahoma City is fantastic for that. I looked at their website. It's really great. You click on the procedure that you want, and it tells you exactly in total how much it's going to be. Now, again, we provide a lot of tax breaks to the hospitals around here, and transparency isn't one of the things that you get for that. Now, I wouldn't say to them, we're going to mandate that you put together a website, because then you'd create a bureaucracy just to manage and watch them do that. What I would say is, in order for you to get you don't have to have the tax break. You don't have to do transparency. But if you're not going to do transparency, no tax break, I would tie the two together. The other thing that I forgot to mention that I want to say is, I was just in Mexico with my kids over New Year's, and it's funny that we went on a cruise. And when you get to the port, of course, there are a couple of things you see. You see a local market where everyone's selling whatever it is they've got for sale, local trinkets and souvenirs. And then, of course, just down the road from that is a pharmacy, where one can purchase all kinds of things, where in America, it would A, require a doctor's prescription, and B, would cost an awful lot more. So there's an awful lot to be said about our marketplace right now and how we deny patients the ability to make their own healthcare decisions. And as a result of that, we increase the cost of the delivery of services tremendously. So it's another thing that ought to be unwound. That's a federal issue.
Kevin, what questions do you have for him?
You know, I go back to what former Governor Otter said, we're the reddest of the red, and the Freedom Foundation continues to hold our red politicians accountable. I mean, it sounds more like we are Republican light than really true Republicans. And I know you're not a nonpartisan group, but, you know, it just seems like a giant bait and switch, where we have the governor, again, at one time, one of the most conservative, advocating for Medicaid expansion. Your thoughts on just the state of things politically?
Well, I mean, I don't know how conservative Butch Otter actually was. I don't want to beat up on Butch Otter, but fact is that, yes, we have a very, very Republican state. And instead of pushing back against Obamacare and coming up with free market solutions, instead we did just the opposite of that. And that was extremely unfortunate. It didn't have to be that way. In fact, I thought we were making all the right decisions briefly after Obamacare became law, because we had a bill that passed in 2010 that said we're not going to require Idahoans to purchase health insurance. That was called the Idaho Health Freedom Act, which we were involved in pushing and putting through the legislature. But the problem is not too long after that, we decided we needed to do an insurance exchange. We were accepting millions of dollars in federal money through Obamacare for that to happen. We didn't have a lot of conversations about how to unwind the insurance company monopolies or hold health hospitals accountable for their out of control skyrocketing costs. We have yet to have a single real conversation about how to rein in the costs of Medicaid. I got to tell you something. I've been watching this for more than 20 years, and I'm horrified by what's happened with Medicaid. Medicaid today is more than the entire state budget was in 2001. That's stunning. It used to be Medicaid was 17% of the budget. Now it's closing in on a third of the budget.
Well, what's your guess that this is going to cost us? What's your projection?
I bet you it's going to
fully implemented. What is it per year?
I bet you it's going to be 3 times what they projected.
So they projected 40,
something like that.
So
it's going to be $120-something million in that neighborhood. Yeah. It's going to be ugly, and here's why. Even the Milliman accounting firm concluded that it was going to cost X, but the X was presumptive that the robust economy with 3% unemployment was going to continue for the next 10 years.
Yeah.
Now, I'm not an economist, but I mean, good luck seeing that happen. I think it's not plausible. And already you're seeing kinks in that armor.
Talk us through the lawsuit. So you have a hearing coming up soon.
Yeah.
You think you're going to win?
Of course.
Assume you don't win. Yeah. What do you predict happens in the legislative session, and give us your thoughts on what's going on there?
Well, first of all, I do think we're going to win. It is a huge issue. And actually, it's an issue that will have profound impacts throughout the country. Basically, in short, it says that the legislature has to legislate. The legislature has to set policy. It can't just say we're going to do whatever the federal government does in perpetuity, because that just makes it to where you're just spending money and you're not really dealing with the real issues of the day. So it's a very, very important case beyond Medicaid expansion. If that doesn't happen, and I, again, don't think that's going to be the outcome, but if we were to see Medicaid expansion remain in effect, what I hope legislators will do is actually have some real conversations about what it takes to keep people off that system. It is not good to spend money without some kind of limitations or control, and that, unfortunately, what Medicaid tends to do. It just continues to escalate in price. So things like putting in real, honest to goodness work requirements. You can't just get the benefit if you're not going to work. Lifetime limits, so people can't stay on the program forever. Putting in place safeguards to make sure that we're not actually just taking people off of private insurance and putting them on government-run healthcare, so they already have access to good quality insurance. We shouldn't be just displacing that because it's easier and cheaper and quicker. I'd also hope the legislature will make charities part of the equation, because when you just put people into a bureaucracy, their tendency to become more dependent on government programs escalates. So putting them in conjunction with a charity and saying, hey, look, John, I know that you have these financial problems right now. You need to be on Medicaid expansion, but we also need to teach you how to balance a budget and have home cooked meals and, figure out ways of saving money and so on. You have to make charities and local organizations that would be invested in people's well-being as an outcome part of that equation.
Wayne, finally, 30 seconds. What inspires you?
Inspired me?
Inspires you.
Everything. You know what inspires me? People who believe in better opportunity and a brighter future for America. Every day I meet people who you can see their eyes get wide in the belief that their days are going to be nothing compared to what they're going to have experienced through their sons and daughters and kids, grandkids. I mean, to me, that is the most amazing, most important thing, is seeing opportunity and delight and potential in everyone's face.
Wayne, thank you.
Thanks for having me.
Thanks, Wayne.
And welcome back to the Inspire Excellence podcast. Tommy Ahlquist, Kevin Miller, and Medicaid expansion continues to be a topic we're talking about, Tommy.
Thank you very much for being here. We really appreciate it. We had Wayne Hoffman just left the room, and now have you in to help us understand the other perspective on this. And that's what we want to do with this podcast. So we'll let you introduce your role and yourself, and then get into it.
Great. Thanks for having me here. I'm Laura Necochea, and I direct Idaho Voices for Children. And we're just one group. We're part of a large group of people who care about healthcare called Close the Gap Idaho. And we've been advocating for Idaho to close our coverage gap for years now. And so it's really exciting to be on the other side of that.
It's great. So just coming off the election, and now we were just talking to Wayne. Earlier today, we had a couple of legislators here talking about the session, talking about the lawsuit that's been filed. Give us your take on where things are currently and what our listeners should be looking forward to in the coming weeks.
Sure. So Medicaid expansion is the law of the land. The election results were certified back in November, and now it's just a matter of the legislature putting the right dollars into the right line items, and passing a budget. We are impatient for people to get coverage, and the people themselves are impatient to get coverage. I understand that the day after the election, some people were knocking on the door at our state agency to see if they could get some health care that they urgently needed. It is going to take a little bit of time for the Department of Health and Welfare to adjust some of their enrollment systems. It takes some technology changes, but people should be able to see their coverage go live in January of 2020.
That's great. One of the questions that we've asked several people today is, having read the Milliman study on what this is going to cost us, and now even since the election, there's been new estimates out. If you had to guess, once this is implemented, and all the people that are out there that can now qualify based on our income levels in Idaho, what do you think the annual cost is for the state of Idaho taxpayers to implement Medicaid expansion?
So it's going to depend a little bit on some policy choices that are made and what we end up doing with our state catastrophic care fund. But when you put it all together, taxpayers come out ahead. If we have to put in about $40 million a year to cover Medicaid claims, we're saving $20 million in catastrophic and indigent care claims that are no longer coming in because those people have coverage, and so we don't have to pay for in this costly crisis care system, we don't have to pay for these hospital bills on the other side. We're going to see about $20 million in new revenue that the state and our local taxing districts can capture because of the economic stimulus that's going to happen. When we draw down $400 million a year in federal funds that otherwise wouldn't be in our economy, that has an economic stimulus effect. And it's not just about, the clinic managers that get hired or the nurses that get hired. It's about when those new healthcare workers in their local communities get their oil changed and go to the movies and have lunch at the local mom and pop drive-through, all of that new economic activity generates tax revenue. The other things we're seeing, and we saw it in Governor Little's proposal for his way to pay for this, is there are savings and offsets that we can take advantage of immediately. It's going to take a while for some of the other savings to come in as people get enrolled and get coverage. Then we'll see the crisis care system claims. We'll see those go down, but immediately we can start to shift some of the dollars where we spend 100% state funds for some behavioral health care services that don't come close to meeting the need. A lot of that can be provided through Medicaid, where the state's only going to be paying for 10% of the cost. So it'll take a while for our healthcare system to adjust, but taxpayers are going to be coming out ahead in the end when it all is said and done.
Tax savings for everyone is what you're saying. There won't be a line item in the budget to cover Medicaid.
There will be. There will be.
So what's the line item in the budget once it's implemented?
At $40 million a year.
40
for it to take care of the Medicaid care. Okay. The claims. But if you see what Governor Little did is he took money from mental health services, hospitalizations in the correction systems, mental health services, and behavioral health services that were providing for people on parole, because we know when ex-offenders are leaving the system, if they need substance abuse treatment, we want to keep that sustained because that's going to help them on their road to recovery and just a crime-free, productive life. We know that community-based treatment is really important, and it reduces recidivism, and recidivism costs us a lot of money. So I'm not even, we don't even have estimates on what savings in terms of reducing recidivism are going to be through this program. But we can draw savings and offsets from a lot of other places in the budget. And that's why Governor Little was actually able to come up with a budget proposal that has a net zero impact on the state general fund. We need some of the startup money. He's drawing from the Millennium Fund, but he's finding a lot of money from other places in the budget.
Everybody wants everybody to be taken care of. And I think no matter what your health coverage is, we're all frustrated with the current system. You have so many folks, though, in the legislature, conservative activists, libertarians saying we can't afford this, especially if there's an economic downturn. What would be your response to that?
Yeah, so that's a great question. And if there is an economic downturn, more people will likely qualify for Medicaid. The same is true with our current systems. When we have an economic downturn and people lose their jobs and they get laid off, they lose their health insurance, and they can still have an asthma attack and show up in the emergency room. If they try to ration their insulin, the implications of that can be, a lifelong disability of losing a limb. Not investing in prevention is very costly as well. And so no matter if we're in an economic downturn or not, the cost benefit is always on the side of Medicaid expansion. And because we get much more bang for our buck providing actual coverage with prevention to people rather than sitting back and seeing who shows up in the hospital and then paying those bills.
So let me ask you a question that, it's been years for me studying this and looking at it. And I've actually just visited almost every hospital around the state. Healthcare is obviously an issue everywhere you go. No matter who you talk to, healthcare is the number one issue. And as soon as you get outside the valley, the level of poverty is just such in Idaho that it is truly a painful discussion with almost everyone of how on earth do we cover it. But I haven't heard you say, and I haven't heard even in the argument, you listen for people to talk about the real problem, and I never hear it brought up. And that is the exorbitant cost of care right here in our valley. And on the campaign trail I was able to visit, there's 17 community health centers around the state. Mm-hmm. You know them well. They do a phenomenal job of caring for people. Unbelievable. And you look at the cost of their primary care versus some of the cost of care at some of the hospital-run facilities around our state. Why don't we ever talk about trying to help these Medicaid patients seek care at locations that is literally a fourth of the cost for primary care as if they go to hospitals? That's probably my biggest concern of this. As you know, the hospital organizations are the largest lobbyist group in the country. I think your husband works for the hospital. They are the number one benefitter of any Medicaid dollars or federal dollars that come in. How come we never talk about how we can provide cost-effective and affordable primary care to all people, including people on Medicaid? Why doesn't that come up?
Tommy, that's the $1 million question. I mean, Medicaid expansion is not going to fix every problem we have, and the
can you argue that it's going to make it worse
healthcare
if you dump more of those dollars into an ineffective delivery care system of primary care?
No, because I think coverage and access go hand in hand, and some of the things. I mean, we have 19 of our 27 critical access rural hospitals are operating at a negative margin. That's not sustainable.
Okay, can I ask you something about that? Mm-hmm. So you go to these critical access, I've worked at those critical access hospitals, but the way the current government funding works for them, they're critical access, they're incentivized to do more procedures. Mm-hmm. So you have a hospital in Weiser, Idaho doing cardiac cath labs. They have no business. So even you say that, but the reason why they're losing so much money is we have an ineffective way of delivering primary care. Yet right alongside of it, we have these community health centers that are killing it. Mm-hmm. Yet we don't even have anyone in the state talking about trying to deliver care where it's inexpensive. I guess that's my concern with this all along has been, hey, it's great that we're passing it.
Yeah.
It's great that, but more dollars dumped into a system, and I know it doesn't cost $48,000 to have an appendectomy. Yeah. You and I know it shouldn't cost $3,700 for an MRI.
Well, and
why is it a good thing to have those dollars go into a system where the costs are just out of control?
Well, Medicaid is actually Idaho Medicaid is doing a better job at containing cost growth than everything that's happening outside of Medicaid. You look at the growth and the per member per month costs in Medicaid, much slower than outside. Medicaid gets to negotiate. It's a big purchaser. It has big purchasing power. So it gets to negotiate prices for medication. It gets to negotiate what the reimbursement rates are for services. So it's actually, it's actually, I mean, putting a dollar in you're going to get a lot of more healthcare out of putting a dollar in Medicaid than you are in putting a dollar, somewhere else in our healthcare system. So I think there are actually things we can learn from Medicaid to apply to the rest of the healthcare system. And Medicaid is also looking at how do we manage, and this is part of a long discussion, but how do we get to managed care? How do we get to making sure people are seeking care at the right kind of knocking on the right door when they need care and going and so that we can pay for it in the most efficient way. And I think they're talking to providers about these arrangements, and so that we can start paying for value and outcomes. And again, not just a fee-for-service system, which has the perverse incentives that you mentioned, and we have to correct that.
Well, I was just going to say, so would you then be in favor of these Medicaid dollars being managed by hospital systems?
I think a contract where we know we're getting value for our dollars, it could be mutually beneficial. I think it would be beneficial to taxpayers. It would be a good use of our public dollars and beneficial to patients as well.
If the hospitals manage the Medicaid dollars. Because
I don't want to. I would say that I'm.
Well, that's what's been proposed out there, right? I mean, that's on the table.
Yeah, I'm not here to advocate for one type of provider over another, I guess, of those arrangements. But I think there's a lot to be gained by making sure we're paying for value.
Let's go back to just Idaho and Medicaid expansion in the legislature right now. Tommy and I have had a chance to talk to the Republican majority leader, the Democratic minority leader. They seem very skeptical again on how they're going to pay for it. We've talked a little bit about that. Then we have this lawsuit that is currently being filed as well. Your thoughts on you're very overly optimistic. What about the other side? Do you think that it could be delayed, or perhaps the court could shoot it down?
I think it's very unlikely that this lawsuit is going to change the law in Idaho. I'm not a lawyer, but that's my that's my sense.
That makes three of us. So no worries.
I don't think it's going to change anything. I think the legislature is full steam ahead in terms of trying to figure out how to implement this, and the state is full steam ahead in terms of preparing for the change, preparing to enroll people in healthcare.
What should listeners out there who may have family members, that's again the process for people that have been waiting for this for a while? You think that by 2020 there will be a chance for them to apply, and what do you think about the work requirements that they're talking about at the state level? I mean, they're trying to put sideboards on, is what the language that they're using. What are your thoughts on the current legislation that's being talked about?
Yeah, so people might be able to start the enrollment application process as soon as perhaps October of this year, with coverage effective January 1st, 2020. I think legislators are going to look at what kinds of sideboards other states have considered. You mentioned this idea of work requirements where, you'd have to, be reporting to the state how many hours you are working at certain intervals. I think that the issues that we're seeing with that and why other states have backed away from it is because it comes with a big administrative price tag. And our fiscally conservative legislators usually aren't too excited to just add a bunch of state employees to push paper around.
Oh, they're pretty good at adding state employees. Yeah. Just in case you're wondering.
I think they're not that interested in adding more bureaucrats to the Department of Health and Welfare. Most of the people in the Gap are working. An extremely high percentage of them are in a working household, and what we see is that, for them to move up to higher earning jobs and the things that we want, the whole reason we're Idaho Voices for Children, we care about parents having coverage so they can work, keep a job and stay on the job and have a financially secure family. We know most of the kids are already eligible, but it's really important that parents are working, healthy, and productive and on the job. And so we'd be really interested in, work training programs that help people climb them up the economic ladder. Anything that just takes people's health care away and adds a bunch of administrative costs to the program. I think legislators and we hear a lot of legislators looking at the math and saying this doesn't make sense. Sure. We're just adding bureaucracy here. And also, frankly, these things are tied up in lawsuits where they're happening in, Arkansas and Kentucky. And so I think some legislators will also take the cautious approach of let's see how the courts come out on, what's legal and what's not in terms of what new requirements we might add to this program. But I think ultimately, I don't think any big changes are going to be made.
But do you worry at all about, I think that I hate the fact that even to have a discussion about is more Medicaid good for a society? You bring that up and people will spin that as well. You don't care about people. I think we care plenty about people. You look at people that currently get stuck on Medicaid. So women and children are already can qualify, right?
Pregnant women
and children already qualify for Medicaid.
And children up to a certain income
But there's
level.
already those people that get caught in that place where they're getting welfare and they're getting food stamps and they're on Medicaid for their children. And there's that wage problem that if they make too much, and when you go through the math with those folks, which I have done a lot in my life, they're really stuck. They sit and look at the numbers and say, listen, I don't want to get a job. I can't get a job because if I do, I have to, you look at the real numbers of that Alice population, asset limited, income constrained, but employed, they're really in a position where it's better off that I don't work because here's what I get now. And in order for me to work, here's what I lose. Don't you worry about that getting worse for the working poor with Medicaid expansion?
Medicaid expansion fixes the problem we have right now in healthcare benefits. I met a woman, a mom in Caldwell, a single parent who was out of work during the recession, and she finally got a job and was really excited that she was working and putting food on the table for her daughter. But her income, because she was a parent, and it's only for parents at very low income levels can qualify for Medicaid, and she had a chronic health condition that required medication daily. As soon as she got that job, she lost Medicaid. She fell into the gap, right? Now that we're closing the gap, someone like her can keep her job, keep working, stay on Medicaid, and then as her income goes up, if she gets more hours or a raise or a better job, she can smoothly move on to the health insurance exchange. That will now be smooth. The gap is what's causing that problem right now. Now, we have other issues with, SNAP benefits. It turns on and off. They don't phase out as people climb up.
I was going to ask you that. The thing that makes the most sense to me is some phase in, phase out. Because if you think about it, if you added some qualifications based on chronic illnesses or cost of care or some other things, there's just some people that get a chronic illness, they're going to need help. And I would love to see more of a phased in approach to Medicaid instead of what we do now, which is this on or off thing, which I think is just inherently got problems to it, right?
Well, Tommy, the voters just solved your problem. By expanding Medicaid, they smoothed that out. They took away that gap where parents' their income goes a little bit up and then they fall into the gap. We don't have that now with Medicaid expansion. They're going to be able to, as their income goes up, they will smoothly transition on to a tax credit that will allow them to buy coverage in the exchange.
Just a final question about cost. The state right now, $80 million shortfall. We hear that they're not going to repeal the grocery tax, which politicians have been promising for 3 or 4 years. They outbid Tommy on HP. I'm still mad about that. They could have saved some money there. What if there's no money? People are really worried about the burden being passed on to the taxpayers. It was promised during the campaign, hey, we have this free money in Washington, but will Idahoans eventually have to pay for the compassion? In your opinion?
The math works out really well for Idaho taxpayers. And, Governor Little just demonstrated in his budget that we can do this without any impact to the state general fund. And that's in this startup time where we have to pay a little bit more. We have to invest a little bit more before we can start seeing the savings from the costly crisis care programs that we have. So, I talked to a very savvy legislator who's fiscally conservative, and his comment the other day was, "I'm tired of people saying that we can't afford this. We can't afford not to do this. The math works out great for us, and so we're going to be seeing not only the fiscal benefits but economic benefits, and it's really a win-win. And that's why you saw so much business support for this during the campaign, So we're helping people, we're helping the economy, we're helping business, and it's really a win to celebrate. And we're just excited and look forward to implementation.
We appreciate you coming on today. Thank you very much for being here and for explaining this to our listeners. Kevin's got one more question for you.
30 seconds. What inspires you?
I've been so inspired by the people who are living in the gap and have been willing to tell their stories and have it on the radio, on the front page of the newspaper, so that regular Idahoans can understand who's being impacted. And these are a lot of moms of, children with disabilities who have a lot of stress on their plate, or, a wife whose spouse has a disability, a service-connected disability, a veteran. And those are the people who just inspire me to keep doing this work and keep fighting this fight.
Well, thank you. And to everybody, have a great day.
You've been listening to the Inspire Excellence podcast. We invite you to find something that inspires you this week. Join us again for our next episode.